So let's talk about this. Psychogenic non-epileptic seizures. This is something that is commonly referred to as a pseudo seizure. All right, so in one of the previous videos I posted, there was a lot of discussion calling these fake seizures. All right, so we need to understand that a seizure is a presentation of something happening in the body. Epilepsy is the diagnosis that causes the seizures, where a psychiatric condition is what is causing those psychogenic non-epileptic seizures. So it means that it is a seizure that is caused from something that is not epilepsy. So these are generally patients who have a psychological condition such as, anxiety, depression, things like that. And there isn't a great understanding of what causes that. Now, with that said, some of these patients can still have epilepsy. So for us in the field to be able to differentiate between the two, we can't. So if we see that patient seizing, we have to treat them all the same way. Now, the presentation is what we might see different, right? So in this, they're not going to generally have that postdictal phase because they haven't had all these neurons misfiring in their brain. So once they quit seizing, they're generally alert and oriented right away. Sometimes within that, they can be seizing, presenting like a tonic-clonic or just convulsing seizure, but they can still be alert during that. But they can still present exactly like a tonic-clonic seizure, so it's just up to us to do very good thorough assessments and treat them accordingly. But to see a patient presenting as tonic-clonic, to determine whether that's a psychological condition or epilepsy, we generally can't tell. So if they're at that point where it's been going on for a very long time, they have airway compromise, we got to treat them the same way because we can't do an EEG to be able to tell that difference.